Abdomen, X-ray indications explained. Suspected bowel obstruction, gastrointestinal perforation. Foreign body, suspected abdominal mass. Acute abdomen volvulus, toxic megacolon, suspected bowel obstruction. Bowel obstruction, also known as intestinal obstruction, is a mechanical or functional obstruction of the intestines which prevents the normal movement of the products of digestion. Either the small bowel or large bowel may be affected. Signs and symptoms include abdominal pain, vomiting, bloating, and not passing gas. Causes of bowel obstruction include adhesions, hernias, volvulus, endometriosis, inflammatory bowel disease, appendicitis, tumors, diverticulitis, ischemic bowel, tuberculosis, and intussusception. Gastrointestinal perforation. Gastrointestinal perforation, also known as gastrointestinal rupture, is a hole in the wall of the gastrointestinal tract. The gastrointestinal tract is composed of hollow digestive organs leading from the mouth to the anus. Symptoms of gastrointestinal perforation commonly include severe abdominal pain, nausea, and vomiting. Complications include a painful inflammation of the inner lining of the abdominal wall and sepsis. Perforation may be caused by trauma, bowel obstruction, diverticulitis, stomach ulcers, cancer, or infection. A CT scan is the preferred method of diagnosis. However, free air from a perforation can often be seen on plain X-ray. Foreign body and alimentary tract. One of the most common locations for a foreign body is the alimentary tract. It is possible for foreign bodies to enter the tract either from the mouth or from the rectum. The objects most commonly swallowed by children are coins. Meat impaction, resulting in esophageal food bolus obstruction, is more common in adults. Swallowed objects are more likely to lodge in the esophagus or stomach than in the pharynx or duodenum. Abdominal mass. An abdominal mass is any localized enlargement or swelling in the human abdomen. Depending on its location, the abdominal mass may be caused by an enlarged liver, hepatomegaly, enlarged spleen, splenomegaly, protruding kidney, a pancreatic mass, a retroperitoneal mass, a mass in the posterior of the peritoneum, an abdominal aortic aneurysm, or various tumors, such as those caused by abdominal carcinomatosis and omental metastasis. Acute abdomen. An acute abdomen refers to a sudden severe abdominal pain. It is in many cases a medical emergency, requiring urgent and specific diagnosis. Several causes need immediate surgical treatment. The differential diagnosis of acute abdomen includes acute appendicitis, acute peptic ulcer and its complications, acute cholecystitis, acute pancreatitis, acute intestinal ischemia, acute diverticulitis, ectopic with tubal rupture, ovarian torsion, acute peritonitis, acute ureteric colic, bowel volvulus obstruction, acute pyelonephritis, adrenal crisis, biliary colic, abdominal aortic aneurysm, hemoperitoneum, ruptured spleen, kidney stone, carcinoid volvulus. A volvulus is when a loop of intestine twists around itself in the mesentery that supports it, resulting in a bowel obstruction. Symptoms include abdominal pain, abdominal bloating, vomiting, constipation, and bloody stool. Onset of symptoms may be rapid or more gradual. The mesentery may become so tightly twisted that blood flow to part of the intestine is cut off, resulting in ischemic bowel. In this situation, there may be fever or significant pain when the abdomen is touched. Toxic megacolon. Toxic megacolon is an acute form of colonic distension. It is characterized by a very dilated colon, megacolon, accompanied by abdominal distension, bloating, and sometimes fever, abdominal pain, or shock.